Hi, my name is Halfreda Garrett and I will be talking to y'all about dermatology. The specialty of dermatology deals with the skin and nails and accessory structures, like the hair and nails. The physician that specializes in dermatology is called a dermatologist. The fun fact is, the skin is the largest organ in the body and it covers a total area of 20 square feet. It functions as to protect the internal organs of the body, and it helps dissipate heat and regulate body temperature, and it also synthesizes vitamin D when exposed to ultraviolet light. It also has some sensory receptors that respond to sensations like heat, cold, pain, and pressure. The most important thing here is that the skin has sebaceous glands that release sebum, and that's an oily substance that lubricates the skin. And the skin ranges from the thinnest to the thick, like the eyelids being the most thin, and the palms of the hand as being the thick. The skin is composed of three layers: the epidermis, which is the thin uppermost layer; the dermis, the thicker layer, which is also referred to as the true skin, and it makes up about 90% of the skin, and the third one, the subcutaneous layer. In the epidermis, there are things called keratinocytes, and they're found in the basal cell of the epidermis, and they travel up in about 4 weeks, and as they move up, they grow scalier and flatter, and eventually lose their nuclei, changing into dead cells that contain keratin. Now, keratin makes up the outermost layer of the epidermis and forms a protective barrier across the surface of the skin and helps control water loss from the body. And it comes off as a result of washing and friction. Melanin. 95% of cells are keratinocytes, but 5% are pigmented cells, which are melanocytes. And this protein is manufactured by the body. It gives color to the skin and protects the body from UV radiation. Keep in mind that the skin is not determined by the total number of melanocytes, but the rate cells produce melanin. It also has to do with the genetics and the amount of exposure to UV light. For an example, albinism. It is an inherited recessive trait where an individual is unable to produce melanin, which makes them have white skin, hair, and lack of pigment in their irises. The dermis. It is a thick layer of the connective tissue that contains collagen and elastin fibers, in addition to water and jelly-like materials that make the skin compressible. Elastin is the flexible fiber that makes the skin resilient, and collagen helps prevent the tearing of the skin. Sweat glands are exocrine glands. Echogrin is present over most of the body, and they regulate body temperature by excreting water or sweat through skin pores to release heat. Apocrine, which are open into hair follicles, are located in the axilla, the face, and scalp, and they secrete fatty sweat in response to stress, which is odorless at times. Microorganisms like normal flora or resident flora are found on the skin and may increase the chance of integumentary system infection. Make sure that healthcare workers are sanitizing their hands before and after each procedure to prevent any contamination of resident flora. The subcutaneous layer. It contains fat cells that provide insulation and serve as a depository for reserved calories. It also contains blood vessels, nerves, and the base of the appendages of skin, which are hair follicles. It is distributed unevenly, and as the body ages, it thins very considerably, which makes drawing more difficult in aging patients because their skin is more fragile. Skin lesions. They can be caused by a systemic problem like an allergic reaction to medication, or may develop from a localized infection. Keep in mind to when you're gathering information about the characteristics of lesions, describe the color, elevation, and texture of the lesion. Does the patient have any pain? Is there any drainage present? Or what is the exact anatomic location of the lesion? Primary lesions appear immediately, like macules, papules, plaques, cysts. Secondary lesions are results of alterations in the primary lesion, like scales, crusts, fissures, or erosion. Infections. Bacterial infections, like impetigo. It's a common superficial infection caused by Streptococci or Staphylococcus aureus, and it usually can be seen in children. It looks like small vesicles on the face, especially around the nose and the mouth, that quickly enlarge and rupture, and excreting a honey-colored exudate. And it usually forms crusty lesions beneath the crust it is inflamed in its endings. Usually itching accompanies the infection, and the scratching helps spread the lesions at the site. It's very contagious, and it is transmitted by direct contact with the drainage. Constant hair washing is required, obviously. If the areas are limited, topical treatment with the antibiotic ointment may be effective. However, if it's caused by streptococci, it may result in glomerulonephritis, which is more involved. When more involved, infections may require treatment with oral antibiotics. Acne. Acne vulgaris. This begins at puberty, and it's caused by a number of factors like inherited predisposition, hormonal fluctuations, exposure to heat and humidity, and the use of oily creams. It is the disorder of the hair follicle and sebaceous gland unit. It develops when the sebum, which is the oily substance, it reaches the skin surface through the hair follicles and stimulates the follicle walls, causing more rapid shedding of the cells. They both stick together and form a plug that promotes the growth of staphylococcal organisms in the follicle. This results in the formation of comedones like blackheads and whiteheads, pimples, pustules, or larger abscesses. Here's a picture of acne vulgaris. Treatment. It usually accompanies twice daily washes with benzoyl peroxide or salicylic acid. Medicines include topical antibiotic cream, application of a retinoid, stuff like that, or severe cystic acne can be treated with isotretinoin, and it's a strong tetragon. It should never be prescribed for pregnant women or women who are not using contraceptives, because the use of oral contraceptives may also reduce acne outbreaks. Acne conglobata. This is a severe form of acne, and it typically occurs later in life and results in lesions across the back, butt, ox, thighs, face, and chest. Abscesses or cysts may form touching affected sites, and healing frequently results in keloid formation. The treatment includes a more aggressive way of treating with systemic corticosteroids, oral antibiotics, or retinols and laser resurfacing or debridement to treat excessive scarring. Here's a picture of acne cone robots. Rosacea. This is a chronic disease seen most frequently in women between the ages of 30 and 60. It causes inflammation and pustule formation and begins as frequent flushing across the nose, forehead, cheeks, and chin. As the condition progresses, the capillaries of the face dilate and are visible across the affected areas as small red edematous lines, and they're accompanied by some eye inflammation and photosensitivity. Over time, the face appears red, and the eye inflammation is more apparent, and painful nodules and pustules form. Men with rosacea may develop rhinoplasma, a large inflamed bulbous nose caused by hyperplasia of the sebaceous nasal tissue. Eventually, individuals may develop obvious thickening of the skin across the forehead, nose, cheeks, and chin. You can treat this condition with topical antibiotics, and as the symptoms progress, with oral antibiotics like Oracea. This helps reduce pimples and bumps on the face, but it may not reduce redness and flushing. Here's a picture of rosacea. Furuncles and carbuncles. Furuncles, or a boil, is a localized staphylococcal infection beginning as inflammation of a hair follicle. The affected area is raised, inflamed, and painful, and eventually may produce purulent drainage. A carbuncle is a collection of furuncles that have joined to form a large infected area. The treatment for the both are the same, which is oral antibiotics, frequent cleansing of the area, application of an antibiotic ointment, and in some cases, surgical incision and drainage of the purulent material. Cellulitis. This is an acute infection of the skin and subcutaneous tissue caused by staphylococci or streptococci. It begins as a small cut or a result of a skin injury or develops at the site of a furuncle or ulcer. The area surrounding the site becomes inflamed and painful with red streaks along the lymph vessels that lead from the infection. The treatment consists of oral antibiotics. You can also use warm compresses that can be applied locally to aid healing, and analgesics, which may be needed to relieve discomfort. Patients are treated appropriately because a systemic infection of this type can develop if the lymph glands become involved. Fungal infections, or dermatosis. Fungal or mycotic infections like Tinea pedis, athlete's foot, Tinea curiasis, jock itch, and Tinea corporis, ringworm, are extremely common. These pathogens tend to live off dead tissue in the keratin layer of the epidermis. It causes no inflammation under the underlying skin. The fungus invades the skin where it has been damaged or is constantly moist. All these lesions are pruritic and characterized by a distinct border with scaly skin that have a clear center. You can diagnose this by the way the skin looks and the patient's complaints of pruritus. The skin can be scraped for the examination under a microscope or skin culture, for which a suspicious area is swabbed or scraped using a sterile technique.